Hi, everyone. I am Angela Rastegar, the founder and CEO of Sunfish. I'm really excited to be here with Dr. Jason Ye of Aspire Fertility. Welcome. Thank you for joining us.
Thank you so much for having me. This is a pleasure and an honor.
Yeah, well, we're going to get into your background a little bit. I'm just going to give everyone a couple minutes to join our webinar. So we've just kicked off. This will be recorded. I'm going to share my screen as well so that everyone can follow along as we kick off with some housekeeping. How's your day going?
It's been great. I think overall, the beginning parts of the week, I'm still at a point in my career where I'm excited to go to work, and I'm happy to say that. So it's been great, and I got lots of kids' activities to chase them down later this afternoon. So I'm looking forward to that too.
That sounds really nice. Well, things are good here too. I know you're off in Houston. I'm based in Los Angeles, as I think everyone knows. We have a busy week here too. We're actually adding to the Sunfish team, so
I
been
love
doing
that.
interviews. And yeah, really excited for this conversation today. So we at Sunfish have started doing periodic webinars with different experts from the field, including mental health coaches, embryologists, obviously reproductive endocrinologists are such an important voice for patients to hear from. And the purpose of this is to give everyone a chance to get their questions answered live with a real expert. It's often really hard to get that first appointment with a fertility expert or to think of all your questions on the spot when you're in those early appointments. So now we have the real luxury and honor of having time with Dr. Jason, who is a double board certified reproductive endocrinologist and OB-GYN and has an incredible array of experiences and expertise. He's actually the national medical director of Inception Fertility. Um, and I'll talk about his background a little bit in a second. He's also an advisor to Sunfish. A little bit about me and Sunfish. So, as I mentioned, I'm the co-founder of this company. Our mission is to support people going through fertility journeys logistically, financially, administratively, and emotionally. And so we work directly with leading fertility clinics all around the country. And our goal is to help people explore and get support as they go through IVF, egg freezing, and surrogacy. So I'm really excited for this conversation. It's a real honor to be here with you, Jason, and to just give everyone who's listening a chance to ask their questions of you. So with that, I would love for you to introduce yourself in a little more detail. I know you trained at Duke. You have been really involved with patient education and working to make fertility care more accessible. So maybe you can just give everyone a little bit of your background.
For sure. Thank you. So yes, my college was at UT Austin, Hook'em Horns, and then and after that, medical school was in Dallas. I think back to a moment in Dallas where there was a physician who went around the table and she claimed to be able to look at somebody and know exactly what field of medicine they would go into. And I remember forever, she looked at me and she said, I have no idea because you're just so different. And I'm not sure what that meant. But I look back and I think it's just been a road that I'm grateful to have traveled. But after med school in Dallas, 7 years at Duke University for residency and fellowship. And those were some incredibly formative years of life with attendings that were written about in textbooks, and they were the beginning, thoughts and flutters of IVF and fertility. So it was really nice to be trained by those docs. And then for the last 10 years, I've been in Houston, Texas, now practicing proudly as part of the Inception network at the Aspire HFI or Aspire Houston Fertility Institute practice. So that's where my home is, and happy to be here with you all.
Fantastic. Well, thank you. And I'm glad you eventually found the right path for you. It's a really special field. Just a little housekeeping as we dive in. Everyone's automatically on mute. You can chat us questions. If you look at the bottom of your screen, there's a little chat button. No one else will be able to see those, and I'll read those off as we go. We also have pre-collected questions from social media, from our followers, the common questions that people want to know as they're thinking about IVF or switching from IUI to IVF. So we're going to run through these. A little bit more about my background. I actually studied medicine early on, became really interested in the business side of healthcare. So Sunfish is the third company that I've started. Most recently was a director at the largest company doing surrogacy and egg donations, where I had thousands of people trying to build their family who couldn't afford the process. And found that really, really heartbreaking and frustrating. At the same time, I started going through my own fertility journey. So a lot of these questions are things that I also wish I had known when I was getting started. And I think it's really important for people to have these extra resources outside of their clinic so that they can make the best, most informed choices for them and to understand what's happening throughout this really lengthy process. So I'm going to stop my share for the moment. Um, or actually, let me just share one more thing just so everyone can see a little bit more about my background here. Have been in this world for many, many years, several decades as well. And here's a little bit more of a background on Dr. Jason. So thank you again for joining. His clinic in Houston is really a leading fertility center. So if anyone's in the Texas area, it's a great opportunity to connect with some incredible doctors.
Thank you for that.
All right, so let's stop the share so everyone can see us. Fertility testing. This is a big topic. The first thing that you have to do is you're exploring a journey. So tell us a little bit about fertility tests. Do they change over time and what do they mean?
Yeah, so it's a great question. Fertility tests, I would say, is at least a third, if not half, of all we do. We spend a lot of time in clinic uh, just looking for answers and doing the basic tests for individuals and for couples. I would generally sort them out into four different categories. We've got the sperm testing and the uterus testing and the tubal testing and the egg testing. You could even make up a fifth category and just say that's sort of the genetic, medical health, make sure that pregnancy is going to go as smoothly as possible testing. Um, Generally speaking, I think many of those tests are stable, but the one that does seem to change the most over time would be egg testing and ovarian testing. And that one I tell people is the bulk and really the sort of backbone of all fertility testing because everything else can sort of renew itself and heal itself and there's always more sperm to be made. But in the reality of eggs and ovaries, eggs essentially are there at the time of birth and they're changing in both quantity and quality. And because of that, there is a change that we can measure through blood testing and ultrasounds.
Fantastic. That's a really helpful overview. So let's talk a little bit more about the blood testing. Many of those include hormonal levels. Can you tell us what those tests are and what they actually show?
Of course. So the main test that we're chasing with ovaries would be the AMH, anti-Mullerian hormone. There's something called FSH. So I'm going to say a plug for Dr. Suhail Masher, who trained me, and he basically was one of the docs that found out what FSH does a long time ago. We also think a lot about something called the antral follicle count, or the AFC. That's something that we measure by ultrasound. And all of those concepts are measuring something that we'll call the ovarian reserve. It's a medical term that I don't think describes the concept that well, but the ovarian reserve is this idea that each person has an ovary that is different and has a different quantity of an egg reserve left because that number does decrease over time. And that reserve, it's not just the quantity that's important, it's really measuring the ovarian sensitivity. And as some ovaries have higher quantities, that's nice to know, but those ovaries tend to respond more sort of soundly and aggressively and productively to medication and stimulation. And that can be very helpful in predicting success rates. I think 20, 30 years ago, FSH was the main and only test. And then somewhere around 20 years ago, anti-Mullerian hormone became the talk of the town. Our professional societies, to be honest, have struggled with whether or not we should be just measuring AMHs on all women, whether they're in or out of a fertility clinic, but we use that test very, very carefully and importantly in a fertility clinic. And then, interesting, my personal favorite would actually be the antral follicle count. That one is an ultrasound where with a pelvic scan, we can look at the ovaries and we can count the number of dots. I'll say the number of chocolate chips in the chocolate chip cookie. And that dot number is the follicle count that gives us such tremendous insight on what the IVF cycle or really any fertility cycle could result in.
Okay, that's super helpful. So I think this is a great kind of teaser into why it's important to come in for that initial diagnostic. A lot of people say, like, why can't my OB-GYN tell me some of
Mhm.
this information about my fertility status? So as you're describing it, this blood work and the ultrasound are important steps that will help someone understand if they are a good candidate for IVF, what their journey is going to potentially look like. But those tests don't always reflect exactly what's going to happen in your cycle. So, can you tell us a little bit more? Let's say you go in, you're seeing a certain number in that ultrasound, a certain number of follicles. What does that mean is going to happen in your cycle, and how could that change as you actually get started with IVF?
Absolutely. I think, these tests are all snippets of the truth. And I think as patients, I'm sure everyone is just wanting one blood draw and one ultrasound to give us all the answers. But interestingly, the female ovaries are super dynamic. They're real tricky and they have personalities, and they sometimes will present different perspectives every week or even every month. That FSH level is notorious for being basically inaccurate. And so sometimes it'll be low, which can be reassuring, but could be true reassuring or falsely reassuring, or it could be high, which kind of feels not good, but it could also be unusually high just on a bad day. The AMH level tends to be a little bit more stable over time, and it's not generally supposed to change through the menstrual cycle. But we also see change if people have been on birth control pills for a long time, maybe a little bit of what we call false suppression, or even there's a phenomenon where that number can change if the blood sample was left too long on the table and maybe it wasn't processed in a timely way. I will say though that antral follicle count, that one is tough to fool. So if we do ultrasounds, maybe one or two scans over the course of a month or two, measuring the follicles that we see gives us a sense of how many eggs could finish the race. And so the analogy I'll often use to patients is, imagine you were a spectator at, a track and field race. And if you're looking at the runners at the starting line, you can sort of assume there's not going to be more at the finish line. Like they're just not going to show up in the middle of the race. And then all of a sudden you start with 10 and end with 20. But generally speaking, that number is a pretty good predictor of what might happen. And that leads us to hopefully counsel patients well and truthfully and honestly about fertility outcomes, because at the end of the day, nobody knows what the end of a cycle will look like. But the more data that physicians can give patients, the better the counseling will be, the more informed the decisions will be, and hopefully the better the outcomes will be.
Okay, fantastic. So if I'm considering, do I want to try IVF? Is something not working? Maybe my husband and I want to come in and do some testing. What is it that we're going to know after doing those testing? Obviously, there's a lot of uncertainty when it comes
Mhm,
to
mhm,
creating life. So
mhm.
let's say we came into your clinic, we did some testings. What are the things we would leave your appointment knowing?
Yeah, so the definition of infertility, which is I still never really love that word because it just doesn't feel right, but that is the medical definition, is defined very simply as 6 months to 12 months of trying without a positive pregnancy test. And you can make that diagnosis pretty easily with like a 5-second conversation, like how long have you guys been trying? Oh, a year and a half. And it's like, oh, boom, the diagnosis is there. The treatments for infertility depend and they change a lot based on what the diagnosis is. And so, I'm a little disappointed that our field hasn't been able to narrow it down even further. But we have these categories, which I think are not necessarily being discussed as frequently as they could be in clinic, but the main diagnoses would be male factor or sperm factor. And then we've got uterus factor and tubal factor and ovarian factor. And then sometimes we see a lot of unexplained infertility. And depending on the diagnosis, we can basically counsel patients based on that. So to answer your question, after the testing's done, which generally speaking would be a sperm test, blood work for both partners, conversation about genetic screening for those who want it, and then certainly an ultrasound. After that, we should have a clear diagnosis and we should be able to say, oh, well, this is a case of, unexplained infertility, or this is a case of male factor fertility, and that may lead the conversation forward. Some diagnoses do sort of directly impact the choice of outcome. I think many diagnoses, and I'm sure we'll get to this, will lead to lots of choice. Maybe we do IVF, maybe we don't, maybe there are a lot of options, but some diagnoses do essentially require us take some very deliberate steps towards something like IVF.
Okay, fantastic. Well, I'm glad you brought up the male factor side. That's something that I always feel doesn't get discussed enough. So, if a man comes in to do fertility testing, what are you looking for and what are his results going to tell?
Yeah, so, this is another one of those challenging things, much like egg testing, whereas every single sperm collection is different. And just because one test shows normal or one test shows abnormal does not automatically mean the guy is fertile or infertile. So, in many ways, that sperm test, guys can benefit from a few repeated semen analyses, especially if the first one was abnormal. But we look at literally everything like pH levels, motility, morphology, total counts, what percent are moving, are they moving fast enough? I think so much of this is the medical mind trying to create lots of criteria to identify male sperm as healthy or not. But at the end of the day, one of the most important numbers is just the total motile count. So if we see that number around 15 million or 20 million or above, we generally feel good about, the outcomes for that couple. But then if numbers start to get much lower than that, we may have to start working down genetic workups or hormone workups because guys can actually be affected with much of the same hormonal issues that women can be affected. Same hormones, same parts of the brain, just different end organs, we could say.
Okay, fantastic. So, this is a really helpful overview. I know it can be daunting if folks are considering going to a fertility clinic for that first diagnostic exam and that first conversation with your doctor, but this is a really helpful overview. You'll basically get a look at everything that's going on the female side, everything that's going on the male side. If you are a hetero couple, obviously, if you're in a same-sex couple or a solo parent, the testing is going to be a little bit different. You can work with an egg donor, sperm donor, or surrogate in those cases, but let's just kind of assume in this example that we have a hetero couple coming in, they've done some testing. What would be kind of the options that they might leave that initial conversation with? And is there anything else you wanted to share about testing?
Yeah, so I think a good framework to talk about treatment options is to maybe introduce the concepts of probability. And so much of what a fertility clinic does is basically talk through probabilities. Because at the end of the day, medicine at a very high level reverts down to probabilities. We all think about, maybe some dramatic movie where the doctor says, oh, well, there's a 50% chance one way or the other. And, that is actually how a lot of fertility consults can go sometimes. And I'm sure it's maddening. It's maddening enough to be a physician trying to explain to people that we don't know outcomes, but I can only imagine how challenging it might be to be trying to make decisions based on this. So we do really, really have to be careful with probabilities. If we use, let's say, a fairly common diagnosis like unexplained infertility, which is a real diagnosis. I'm not a fan of the name, but it is something that we see often where sperm is normal and the uterus testing and the egg testing is normal. In those cases, unexplained infertility can lead to a wide array of options. And one option could be as simple as, oh, well, everything is normal, therefore, why can't we get pregnant on our own? And the quoted probabilities on that, once that diagnosis has been made, is around 1% to maybe 2% per month. So it's not zero, but you can imagine that at that probability moving forward, it's not maybe substantial enough for us to feel very optimistic about things. And also, we didn't talk about this much yet, and I think it's an important point. Those egg tests that we talked about are measures of ovarian egg quantity, not egg quality. And quality is changing in the background. It's unmeasurable. We really have no tests to measure someone's quality. So, therefore, as time moves forward, even at that 1% to 2% per month, we feel like we may be losing something. And then we can launch into a discussion about treatment options like medicated IUI cycles, which are generally going to hit around 10% success rates. And then we can also introduce the idea of IVF cycles, which could be maybe as high as 65% success rates per try for the sort of optimal patient who's in those, 30s or late 20s age groups. And then sometimes it may be a little bit lower, sometimes much, much lower, depending on certain factors for the couple. So that's a sort of a very broad diagnosis where basically all options are on the table for couples.
Fantastic. And I'll just add, that's a really helpful overview. Thank you. I'll just add where sunfish plays a role. So if you and your partner or you soloed decide you want to try IVF, there are a lot of options within what an IVF cycle can look like based on your diagnosis. So as a very simple example, you could do a double retrieval, two retrievals up front to try to get more embryos early on. The way in which you can inject the sperm into the egg can be done in different ways. ICSI is a procedure where the sperm is actually injected directly into the egg. So all of those decisions you and your doctor can talk about, they all have slightly different price points. And the way Sunfish will help is if your clinic partners with Sunfish, we would create a custom package for you based on your doctor's protocol, be that double retrieval, egg seed, maybe using a sperm or egg donor even. And then everything's included in that package, unlimited transfers and a partial money back guarantee if you're not successful. So that is designed to help with a lot of the uncertainty that we were talking about, where if you're starting IVF, you're looking at probabilities, you're not sure exactly how many tries it's going to take. Sunfish was designed to try to protect people in those situations where you're just buying one flat fee bundle and then everything's included, unlimited transfers, all of the medical work at your clinic, and a money back guarantee in case you're not successful. Obviously, we hope you are on the first cycle, but it usually does on average take a couple cycles for just looking at national data,
Of
and then you
course.
can get that money back guarantee.
Yeah, I love that. I think that's such an insightful point because, literally every physician, scientist, embryologist is pushing on success rates, trying to make outcomes better. And, at some point, I'm sure many people have seen the chart of what IVF success rates look like as age increases on the female partner side. And you can basically cross out the word age and change that to egg quality. That's essentially the best predictor of egg outcomes. And even though I think the world of science is trying its best, it's not uncommon to be, requiring multiple embryos or multiple cycles to get an IVF cycle to work. And so, I like to use a basketball analogy. Once upon a time, I used to play a lot of basketball, and my skills have deteriorated quite a bit since then. But back in the day, maybe I needed one or two shots to make a bucket. Now I might need two or three or even four sometimes. And I think it's a good perspective that Sunfish can support patients on the journey if it takes more than one.
Yeah, fantastic. All right. Well, this half hour is flying by. We have a couple other questions, and I want to make sure for
Of
you to make
course.
any comments that you'd like to make just about getting started. But one thing I'd love to hear from you, we see a lot of social media, actually a growing amount of social media on the topic of IVF and fertility. What's the most common piece of misinformation that you see or something that you wish people knew?
This is going to be a hot take, but I hear a lot of patients ask about supplements. And they are convinced. I mean, yesterday it was a 20-minute conversation that I feel like may have gone off the rails a little bit. A patient asking about, well, they were changing their diet, adding exercise, taking all these supplements, and convinced that that was going to improve egg quality. And I think a lot of influencers and certainly advertisements may show this, like bottles that say like, oh, egg quality pill or whatever. But we have to be clear. There are no known ways to improve egg quality. And if it was as simple as a pill or a lifestyle change, I think that would be incorporated, mandated into every IVF cycle. Like if there was a magic pill to make outcomes better, I think we would make everyone take it and just be like, this is part of your protocol. But instead, you have to reframe this. And I tell people that time is quality. It's a little bit of a hacky analogy, but I use the analogy of grocery shopping and refrigerators because I love grocery shopping and we like to cook a lot at home. And, as time goes forward, there are moments where you think to yourself, oh, well, the ingredients I got were good and we should use them. But as time goes forward, we have to be very careful about not waiting too long potentially. So time is quality, and I would be very careful to load on too many supplements or in maybe dangerous cases, use up time taking supplements in the expectation that outcomes will be better.
That's a great answer. Yeah, I think my biggest concern is I love Reddit. I love going on Reddit to see all of the emotional support that people provide each other, but
Same.
everyone's journey is so unique, and there
Mhm,
may be things that your doctor's recommending to you that's
mhm,
specific to you.
mhm, mhm.
So I always get worried on social media when I see people giving really specific
Yeah,
recommendations
yeah,
or trying to make interpretations about a specific result. There's just a lot of variance in here. And as you said, if you're starting with 20 eggs, that's not necessarily going to translate
mhm.
into an exact number of embryos and
Of
then
course.
healthy embryos after that. So there's so much variance that happens in every cycle. And I wish on social media people were really treating each journey uniquely and working with their doctor instead of trying to give
Yeah.
each other advice.
Yeah, I mean, at high levels of science and academics, oftentimes the answer, unfortunately, is we don't know and we're not sure. And in this world of social media and the digital age, a very confident, push for a pill or a change or a lifestyle can be so convincing. And it's the confidence of somebody that can be so appealing. But unfortunately, I think that hasn't really been seen to be the case in our field. I don't, not sure if we have time for another one, but something just came to mind
Sure.
actually about, I think a lot of patients ask about the hormones and the safety. So, they think that the supplements are safe, which honestly, that could be an hour long plus discussion on its own because supplements are not regulated by the FDA. And then there's this feeling that the hormones that we use for fertility treatments are dangerous. And so we spend a lot of time trying to dispel that myth in clinic as well, because the hormones that we use are, namely, something called FSH. We'll call back to something that we said about 20 minutes ago. So, the same FSH hormone that we measure in blood is the main hormone that we use during IVF. And so, essentially, we are using what we call a recombinant or purified hormone to be given back to the body. And it speaks the same language that your ovaries and your brain use to speak to each other. And that's essentially what IVF meds are. These are not unnatural hormones. And in many ways, ironically, it's the oral medications, things like clomiphene and letrozole, that we use more often in IUI cycles that are the much more unnatural hormones that we use in a fertility clinic. And so I think people are often surprised to find out that IVF is just taking the volume that your brain talks to your ovaries with and just cranking up the volume a little bit more to try to encourage, more runners to finish the race, to use the analogy from before.
That that is a really good point, and it's helpful to remember. I think it can feel like a lot. I've gone through the injections myself. It can feel like you're putting a lot into your body, but it's actually just a 10-day period or so for a retrieval. It's pretty minimal. There's a lot of egg donors that have done 5 or 6 cycles, even have gone through this. And yeah, I think it your body actually recovers within usually a week or so. And
Yeah, it's a quick thing. It's you know we've taken IVF call back to my attendings that trained me, but a lot of doctors and a lot of patients have worked really hard. I would even say have suffered 30, 40 years ago with open, almost C-section style incisions for an egg retrieval back in the day when IVF was being done. And I think we take it for granted, for egg retrievals to be a quick 10-minute procedure now. Back in the day, these were multi-hour cases done at 3 o'clock in the morning because, we didn't know how to control ovulation and time things. And it is a very straightforward procedure now, but we came from a long history of people who paved the way for us, and hopefully patients moving forward could benefit from all this technology that we have.
Absolutely. All right. In closing, what's your main piece of advice you give to someone who's considering IVF?
I think the best thing I would say is, once that decision has been made, everyone has a different set of outcomes and probabilities and all of that. But it's really important to be confident in that choice because, as I was saying before, IVF, I think, still has the reputation of being the treatment of last resort for many couples. And people would often do multiple rounds of other things or wait a long time and then finally arrive at IVF when actually the majority of the research now suggests that in light of egg quality changes and health changes, especially this new concept that we do called embryo banking, that it may actually make more sense to be confident in that choice, learn about it, and then just kind of prepare yourself, mind and body, to jump into it. And, IVF on one hand is taxing and it takes some time and energy, away from your own life. But on the other hand, like practice the self-care, be graceful to yourself, do the things that kind of help you sustain life through the week. And if it's a hard week, do something to treat yourself because at the end of the day, it still represents the most active and successful opportunity that couples and individuals usually have for pregnancy. And I think that second guessing that decision just kind of adds another layer of frustration and complexity to it. So once that decision's been made, I think to sort of, think about it, move forward, learn about it. I don't know about the audience, but I'm sure people who know about Sunfish are very active on the internet and read and think a lot, and even conversations with ChatGPT, like I sometimes will play on the internet and ask about how much does this system know about IVF? And I'm surprised actually in many ways. A lot of the questions that if you feel like are gaps in knowledge and you want to understand the science of it, and maybe that'll help comfort somebody about the next process, that can be a good thing too. So yeah.
Thank you. That's fantastic advice. And I know it's a lot to navigate. That's really why Sunfish exists. We're here to help. So if you need resources, our website, joinsunfish.com, has a ton of videos, our other expert videos like this one, blogs, etc. So please contact us. We'd be super honored to help. If people want to contact you, what's the best way to get in touch?
So I'm moderately active on Instagram. My practice, Aspire HFI, runs a pretty busy account, so people can reach me through there. Certainly, welcome to book consultations through at the practice site there. And then, I do have a little bit of a LinkedIn presence as well if people want to reach out professionally. But at the end of the day, we're just happy to support anybody. And thanks for having me.
Thank you so much. This was such an incredible conversation. I feel like we could have stayed on for 3 more hours.
Of course, always,
There's
always.
so much to cover, but I think this was a really helpful overview of getting started, fertility testing, how to interpret some of those results. And yeah, we're really grateful for your time and expertise. Thanks for sharing all your knowledge. And we at Sunfish would be really honored to help anyone who's considering their journey.
Fantastic. Thank you for having me. Thanks for putting on such a great little chat, and,
All
and
right,
props to you
thank
and your
you.
team.
Have a great
All
afternoon.
right. Be well. Bye
Bye.
for now.